Good afternoon, and thank you for joining us for our weekly update. I'm very pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health, and Darren Rizzi, our Fire Chief and Director of Emergency Management. Tomorrow marks 1 year since the World Health Organization declared COVID-19 a global pandemic, as the Government of Canada has designated Thursday, March 11th, as the National Day of Observation to commemorate the people who have lost their lives during COVID-19 and the significant impacts we've all felt during the pandemic. Tomorrow, we will remember the 377 Mississaugans who have died from COVID-19. And of course, we will reflect on the impact that this virus has had on so many in our community, in particular on our small business community, who have been so drastically affected by lockdowns, as well as the thousands of people who have lost their jobs during the pandemic. To mark this significant date, we will be dimming the lights on the city's clock tower tomorrow evening. I know that all of us can't wait to put the pandemic behind us, and I'm hopeful that our vaccine rollouts will ramp up, and soon we will return to some semblance of normal as we begin to recover. Now, speaking of vaccines, I shared some great news last night on social media, and I'm really excited to be sharing it once again here today. Mississauga and all of Peel Region will be taking part in a new pilot that will see 8 of our primary care partners administer the AstraZeneca COVID Shield vaccine to residents ages 60 to 64. What this means is that more Mississaugan residents will have access to the vaccine sooner. The age group 60 to 64 was chosen because right now it's recommended that AstraZeneca vaccine should only be used for people under the age of 65. Peel as a whole has been hardest hit region in the country during the pandemic. And ensuring we can quickly vaccinate as many people as possible is critical to our recovery efforts. The 8 primary care providers participating in the pilot will not be taking appointments, but instead will be directly contacting eligible Ontarians aged 60 to 64 to book an appointment starting today. I want to thank the Government of Ontario, and in particular Premier Ford, for prioritizing Mississauga. The Premier and I don't always agree on policy, but he is one of the hardest working people I know and truly has the best interests of all Ontarians in his heart. The pilot project is part of a larger vaccine rollout, which already has seen more than 60,000 residents vaccinated in Peel so far. Thousands of residents 80 and older have also pre-registered, in fact, for vaccinations through Trillium Health Partners. I again encourage everyone 80 and older, or if you have a loved one who is 80 or older, to visit Trillium's website to book a vaccine appointment. Their website is trilliumhealthpartners.ca. Trillium will continue to keep their booking systems up and running after the province launches their own on March 15th. So people in Mississauga will be able to continue booking vaccinations directly with Trillium. If you don't have internet access or are having trouble booking online, please call Peel Region's COVID helpline, where someone will help you book an appointment. That number is 905-579-5202. Again, that's 905-791-5202. In Mississauga, all 5 of our mass vaccination sites are fully operational, with the International Centre launching today. We now have the capacity to vaccinate thousands and thousands of people every single day. All we need is more supply. I will continue providing updates on the vaccine rollout, including details on when and how different age groups will be able to book their appointments. Please also continue to visit Peel Region's website, as well as the City of Mississauga, for updates. Tomorrow evening, the City of Mississauga will also be hosting a COVID-19 teletown hall where I'll be joined by Dr. Lawrence Lowe, Michelle DeManuel, the CEO of Trillium Health Partners, as well as a number of City councillors and our City Commissioners. We'll be answering calls and your questions on a variety of issues, including, of course, our COVID recovery efforts and the vaccine rollout. I really encourage everyone to join tomorrow at 7 p.m. You can find out information on how to join at mississauga.ca/town hall. Last week, Peel Region, including Mississauga, was moved into the grey zone in the province's COVID framework. This was a positive step forward as it allowed some of our small business owners to open up with 25% capacity. I was, however, as you know, disappointed we weren't moved into the red zone, which would have allowed for more businesses, including restaurants and personal care services, to open. But I understand Dr. Lowe's reasoning. After 7 straight weeks of declining numbers, we saw a small uptick in our case counts last week. And most significantly, our R factor, the fundamental indicator of community transmission, which went over 1. When you have an R factor over 1, it means that every person in the community who contracts COVID-19 will give it to at least one other person. That means the threat of exponential growth is real and significant. I heard directly from so many of our small business owners who were very disappointed with this decision. And I completely understand your frustration. I was frustrated too. But here's some more promising news. We're heading back in the right direction. According to Peel Public Health's latest epidemiology report, Peel is averaging 88 cases per 100,000, down from 95 last week. Mississauga, and this is where it gets really good, is averaging 63 cases per 100,000, down from 74 last week. Most importantly, Mississauga's R factor has once again dipped below 1 and is now at 0.91. Our hospitals remain stable, with Trillium currently dealing with 52 COVID hospitalizations, 14 patients in the ICU, and 40 suspected cases. Similar, in Brampton, William Osler Hospital currently has 49 COVID hospitalizations, 7 in the ICU, and 43 suspected cases. In Peel, 8 long-term care homes, 5 retirement homes, and 9 group homes and assisted living facilities are in active outbreak. We are once again, however, headed in the right direction. As a result, I believe this is the right time for Mississauga to move into the red zone, with or without the rest of the region, so that more of our businesses can reopen. Mississauga residents, businesses, and faith-based groups have done an outstanding job getting our numbers down by listening to the advice of public health. But our small business owners are seeing Mississauga residents, their customers, go into neighboring cities like Oakville to shop and dine out, when our numbers here warrant us being in the red zone too. Now, I don't have the power to make that decision, as we know. When we move into a different color, that's in the Premier's hands, who is advised by the Chief Medical Officer for the Province of Ontario, Dr. Williams, who seeks recommendations from our very own Dr. Lowe. But last night, I did ask Dr. Lowe and the Premier to allow Mississauga to move into the red zone on its own. We can no longer afford to be held back just because case numbers in other cities in our region aren't quite there yet. Yes, we're one public health unit, but Mississauga is its own city and its own city government with its own residents and its own businesses. We need a targeted approach. One of the main arguments for applying the same restrictions across all of Peel Region has been that there's been simply too much movement between Brampton, Mississauga, and Caledon. But the reality is that there is movement between Mississauga, Oakville, Burlington, and Milton, between Brampton and Vaughan, between Toronto and Markham. Oakville, Milton, Burlington are in the red zone. So are Markham and Vaughan. Our case numbers warrant us being there too. I was voted in by the residents to advocate for Mississauga. So today I am urging Dr. Lowe and the Premier to move Mississauga into the red zone. That's what's fair and equitable for Mississauga residents and for Mississauga business owners. Dr. Lowe has assured me that he will be bringing my request to the Chief Medical Officer of Health, and I'm eagerly awaiting his response. Before I ask Dr. Lowe to come up to the podium, I will quickly want to thank my colleagues for unanimously passing a motion today that was brought forward by Councillor Carolyn Parrish. The motion asks that the Ontario government prioritize and expedite vaccinations for Peel residents who work in settings where we have seen high rates of transmission. The province recently announced a new distribution process that factors in a variety of risk factors in addition to age, and we believe workplaces should be one of them. The reality is that we have seen roughly 370 workplace outbreaks in Peel, largely in warehouses, manufacturing, distribution, and food processing and packaging facilities. These are places where essential workers are keeping our economy running and providing us with the things we need to survive the pandemic. We need to protect them as they continue to shoulder a disproportionate amount of the risk of COVID-19. And with no movement on mandated paid sick days to protect those workers, we believe prioritizing them in the vaccination rollout will help keep these workers and workplaces safe. This will also play a significant role in keeping our numbers down. Our motion will be shared with the Premier, the Minister of Health, and with all Peel MPPs. I want to once again thank my council colleagues for continuing to be strong advocates for the most vulnerable in our community. And now, I'd like to invite Dr. Lowe up for his update.
Thank you, Madam Mayor. Good afternoon. Mississauga's test positivity for COVID-19 this week sits at 4.4%, which is slightly down from 4.8% last week, with a weekly incidence rate of 63.2 cases per 100,000, down from 74.2 per 100,000 last week. Over a year ago, we stood on the precipice of a first wave that was bearing down on our community. 3 cases had been identified in the region of Peel, with a flood of investigations started, many returning U.S. travelers, with us at Peel Public Health soon realizing that we were experiencing community transmission of COVID-19. The world was changing before our very eyes. As we came together as a community to close and stop the first wave, we saw hospital ships and refrigerated morgues in New York City. We too had our own residents who fell sick or succumbed to this novel disease. And we saw our healthcare and hospital systems stretched but not broken thanks to the strict closure measures that were imposed. The summer provided a brief moment of relief, but a second wave would again test us. And through it all, our most vulnerable continued to bear the brunt of the disease, our essential workers and our elderly, as our businesses and residents continue to sacrifice to reduce the toll. And so a year later, 63,000 cases as of today. 63,000 stories that shouldn't be forgotten. Thousands hospitalized, young and old, many crowding into our intensive care units at the heights of each wave. And 625 lives lost and others that will bear the chronic effects of the disease for years to come. And yet, so many more saved by those sacrifices made by so many of you for your fellow residents here in Mississauga and in Peel that you do not know and may have never met. That is the measure of a community in caring for others. And I want you to know that your sacrifices have not been in vain. And I hope that you are given any and all assistance in recognition of the disproportionate burden Peel has borne in keeping our community and our province safe. But let's not forget why we have banded together. While we may be tired of our present circumstances and have discovered that pandemic life is no longer novel for us, it's important to remember that biologically, the vast majority of us still remain susceptible to infection. From a scientific perspective, the virus is still as novel as it was a year later, and its variants are more transmissible. Thankfully, a year later, the data is also clear that widespread vaccination coverage provides us a way out of this, even with the first shot among those that require 2 doses. Peel Public Health, together with our hospital partners, have mass vaccination sites and mobile teams ready to go once vaccine supply permits. Our hospitals, through their limited allocation, have started providing protection to those 80+ in our community, even as we continue to vaccinate our high-priority healthcare workers and first responders. Even with supply at a trickle, we are getting this train to move. But I know that it's frustrating. I know that the waiting seems endless. I want you to know that I do not make my recommendations easily. Like you, I also long for a hug from my extended family, a beer on a patio and laughter with friends, and frankly, a return to something that resembles a life more normal. But we are now entering the hardest part of the pandemic. And like a DJ switching between tracks, we are trying to slowly fade out protective measures while fading in vaccine coverage with little margin for error, lest the music stop altogether. As the vaccine gets out more and more spring weather comes along, we will continue to monitor and gradually loosen restrictions with an aim to do so permanently. This will take time, but we are pursuing a one-way exit from the measures, lest moving too quickly creates another wave that would again cost lives and interrupt our vaccine efforts, ruin more livelihoods, and needlessly create thousands more COVID stories. So I thank you for your patience and for staying the course. Please keep staying home as much as possible, limit your contacts and follow the precautions, and as supply permits and when it is your turn, get your shot. Thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. And before I take questions from the media, I want to remind people to get their nominations in for the city's COVID Heroes campaign. Our COVID Heroes campaign honors the extraordinary Mississauga residents, businesses, and organizations who have stepped up big during the COVID to support the community. There are so many exciting examples of this. People who sewed masks and prepared meals for those in need, the countless businesses and organizations that donated PPE to our hospitals and our long-term care homes, even those in the community who simply checked in on elderly neighbors once a week to make sure that they were doing okay. We are honoring our heroes through a tribute ceremony in April and by erecting a freestanding monument at Celebration Square. The nomination period is open until March 19th, so please nominate a hero in your community at mississauga.ca/COVID Heroes. And now, I'm happy to take questions from the media.
Your first question comes from Chris Glover at CBC News. Go ahead, Chris.
Hi there, guys. Thank you very much for taking our questions. This is for both the mayor and also Dr. Lowe. We're talking a lot about the pharmacy vaccine pilot program that's happening, and we know that pharmacies in Toronto, in Kingston, and in Windsor are going to be administering the AstraZeneca. We know that Peel has, throughout this whole thing, had some of the highest COVID numbers, and yet it's not included in this pilot program. Could you just react to that for us, explain what you thought when you found out that Peel was not going to be a part of this, and I think wrapped into this, your excitement over the 8 primary care locations speaks a little bit to perhaps a trade-off that happened here. Could you elaborate on that as well for us?
Well, Chris, thanks for the question. You're quite right. We were all a little disappointed. We were all a little deflated to learn that we weren't going to be part of the AstraZeneca pilot that was occurring in 3 municipalities, 3 cities, Toronto, Kingston, and Windsor. And of course, Kingston has done a great job with their numbers, as is Windsor, and I think they're in the green zone, whereas here we are in Peel, still in the gray zone. And of course, we thought we could have benefited advocated for such a pilot ourselves, but we're very fortunate to now have this primary care pilot project starting up here in Peel region, where 8 different primary care providers will be providing the vaccine, the AstraZeneca vaccine, to those 60 to 64, because of course we know that it's not appropriate for over 65 yet. So as you say, a little bit of a trade-off. I did note that Toronto was in both pilots. I'm sure we would have appreciated being in both as well, but we're very, very pleased to be part of the pilot with the primary care providers. Thank you, and Dr. Lowe, call you to the podium.
Yes, thank you for the question. Thank you, Madam Mayor. Certainly the biggest limiting factor for our mass vaccination clinics here in the region of Peel continues to be supply. And I certainly recognize our provincial partners are working tirelessly to ensure that the needs of various communities are met and that the supply that is being distributed is being shared, in a manner that really addresses the ongoing transmission pictures in various communities. I think to the extent that they are aware of our situation in Peel, they are aware of, the view that I share that, if you manage to get things under control here in our region and throughout the Greater Toronto area, you are certainly, protecting not only residents here, but essentially the province at large. I think our conversations continue, and we're very grateful for, our partnership with the ministry, and look forward to hearing as more AstraZeneca and more supply becomes available, how we can make sure that vaccination efforts here in Peel will be appropriately resourced. Thanks very much.
Follow-up?
Yeah, thank you for those responses. Appreciate that. When I heard you explain the difference between what will be happening at the primary care versus what's happening at the pharmacies, it does sound a little bit different, because for the pharmacies, you can book your own appointment, you can reach out to them, do it proactively. With the 8 primary cares, I believe I heard you say that they would contact those people who might fit the eligibility criteria. So I'm just wondering if you have any concerns. I know you just mentioned, and I had mentioned as well, it sounds like a bit of a trade-off, but do you think you got as good a deal with what you're getting with the 8 primary care spots as with having the pharmacies?
Look, Chris, of course we would have liked to have been in both pilots, but we're very pleased to be part of the second pilot with the 8 primary care clinics providing the vaccinations, the AstraZeneca vaccine. I do have concerns on who is selected, how they are selected, when it will start, etc. All those questions remain unanswered, and we are waiting for more details. Of course, there are many 60 to 64-year-olds who have been contacting me on how they're eligible, how they sign up, but I guess we'll have to wait for the details to learn more about how the primary care providers will be reaching out to, whether it's their clients, their patient base, whether they've been identified by Trillium Health Partners. We aren't sure the answers to those questions yet. Chris, Dr. Lowe, do you want to take a stab at that as well? He's going to come up and respond too.
Yeah, thanks very much for the question. Thank you, Madam Mayor. I would highlight at this point in time, we are grateful for any and all supply, as I've said, recognizing that the sooner that we can vaccinate here in the region of Peel and get our coverage up, the sooner we can start to, explore the measures that are currently in place, and also really hopefully see a decrease in hospitalizations and deaths, and also, control of the disease in our community. So to the extent that I know our provincial partners, and we continue in conversation with them, are aware of our need and our situation in Peel, we will await those further details and make sure that the pilot is rolled out in a manner that will ensure that this protection is provided to the members of our community here, with the hopes that more supply, as anticipated, will continue to make its way into Peel. Thanks so much.
Dr. Lowe, the next question is for you as well, actually. It's from Steve Cornwall. Steve Cornwall at the Mississauga News. Go ahead, Steve.
Dr. Lowe, how are you?
Hi, Steve. Doing well, thanks.
That's good. Just a question around Mayor Crombie was speaking about the potential of Mississauga going to red, and she said she approached you and Premier Ford with that request. I'm just curious, previously you had said that we couldn't separate, Caledon and Brampton and Mississauga due to the connectivity of the region. I'm just wondering, from your perspective, has anything kind of changed over the last few months in that regard?
Well, Steve, as Mayor Crombie identified, she did provide that request to me, and I did commit to undertake to present her view to the Chief Medical Officer of Health in the course of our discussions. I still fully recognize that there are numerous interconnections between various parts of the cities, as well as the healthcare systems, in terms of Brampton and Mississauga, and I also recognize that my mandate is as Medical Officer of Health for the provincially defined public health unit boundaries. So I think to the extent that I have certainly heard the request and I'm willing to communicate that this is the position of our local leadership, at least in one of the municipalities, I think it will form part of our ongoing conversation and discussion. My hope, however, is that the trends continue to remain favorable for all of our municipalities, and perhaps that this decision will be made for us if the numbers do continue in the correct trend. Of course, recognizing that first and foremost, we must continue to reopen gradually, lest we, lose all of the gains that we have seen through the measures that have been taken to date. Thanks for the question.
Follow-up?
Yeah, I'm not sure if you wanted to comment on that as well.
I
Mayor
do,
Crombie,
actually. Thanks for the opportunity. Yeah, so if you've been noticing that certainly our case count numbers are half of those of Brampton's. Our factor is down. Our positivity is quite a bit lower. We have the indices in place, and we've been monitoring them all very closely. I think our council motion today will go a long way to help supporting those essential workers that live in Brampton, asking them that they be prioritized as they're working. They are the essential workers that help provide food on our tables. They're in our manufacturing, our warehousing, distribution, food processing, etc. So I think there's a nice balance there that we give Brampton the help it needs while we reopen. I mean, there's a lot of movement, as you know, between Mississauga and Oakville. We share a border. There are a lot of people from Mississauga that moved to Oakville, Burlington, Milton outlet malls, etc. I know that people in Toronto are going up to Vaughan outlet malls. There's a lot of movement, and it doesn't seem to be impacting the case numbers. So I think there's a lot of east-west going along, more so than north-south. So I think it's time that Mississauga be opened. I think many people agree with me, and I hope we can make a compelling case to Dr. Williams. There is a precedence that a region was split with Windsor and Essex previously, with the temporary foreign workers in Essex having higher case counts and being more impacted by the virus than those in Windsor. So we'll hope that Dr. Williams will agree and see that we have done a great job here in Mississauga moving the numbers down and keeping on top of the guidelines and taking the advice of public health. I think we deserve to open red.
Follow-up, Steve?
Sure.
Welcome.
Just a quick follow-up on the pharmacy pilot. You
Sure.
mentioned that kind of Toronto was in the pharmacy pilot as well as the
Primary care
pilot
pilot.
that was announced. The pilot was announced today for primary care. Yeah. I'm just kind of get a sense of was this a decision that, did you know that Kingston was going to be in it? I'm just trying to get a sense of what level of consultation there was with, perhaps yourself and Dr. Lowe, and before the province had made this decision.
So I was informed by Dr. Lowe that this was coming, and it was embargoed news. We have been waiting for more details with respect to the rollout in the pharmacies and with the 8 primary care providers. If they've been selected, I'm not aware of it. Perhaps Dr. Lowe has more information. He's the one who keeps us informed as when these new programs, including these pilot programs, are announced. So he's informed us, and we may ask him if he was consulted. I can say that we were not. Thank you.
Thanks, Madam Mayor. Thanks, Steve, for the question. Certainly with the vaccine supply chain as volatile as it is, information is coming out, day by day, hour by hour. And so I think it was at I just recall being advised, in the course of some of our discussions with our provincial partners, that the pharmacy pilot was going ahead in these 3 regions. Beyond that, I think there were other questions around, where and when will it be going out to primary care? And so subsequently we were notified of that pilot as well. like I said, our provincial partners certainly doing the best with the limited supply that they have, and recognizing the diverse needs across the province. And I've been very clear. I think they know about our situation here in Peel and our needs here in Peel, and continuing to have a partnership and conversation with them. But like I said, I think in the course of the rollout with the supplies that are coming, I recognize that they need to take decisions and make sure that that vaccines are moving in whatever methods and opportunities are feasible to the task. So that's the extent of our involvement and how I heard about the pilots through the course of consultation. Thanks.
Next question, please.
Your next question comes from Isaac Callan at The Pointer. Go ahead, Isaac.
Hey, Crombie, how are you?
I'm very well, Isaac. How are you today?
I'm good, thank you. I'm going to pick up on the vaccines as well, along with Chris and Steve.
Sure.
And just the numbers in particular. The provincial press conference today, we found out that 29,500 of the vaccines will be given to the primary care pilot out of the total of 194,000. So the bulk of these vaccines are still going to Windsor, Essex, Kingston, and Toronto. I'm going to be quite blunt because I think we've gone through the technicalities. Peel has been the hotspot of COVID-19 throughout this pandemic. Is that good enough for Peel to get just a share of 29,500?
I guess the answer is no. It's very unfortunate that we weren't considered to be part of the other pilot. I'm not sure why that decision was made, but it wasn't. But we are very delighted to be participating in the primary care provider pilot as well. So these are both very new programs, Isaac, and there's not a lot of information yet. We aren't aware. I think there's 370 pharmacies that will be participating. I don't think we're aware which ones those are. There are 8 primary care providers in our pilot, and we're not aware of who they might be either. So there's still a lot of information that's forthcoming. And maybe when there is more vaccine, the pilot will be rolled out to other regions such as Mississauga and Peel region. Dr. Lowe, do you want to take a stab at that as well? I'll ask him to come to the podium for you, Isaac.
Yeah, thanks, Isaac. I think, like I said, we have worked very closely with our ministry partners. I think they're aware of the situation that we have here in the region of Peel. I'm also aware of the need for them to take decisions with the allocations and supply that are coming in. And I certainly have, assurances and have impressed upon them that they are aware of the very significant needs, the mass clinics that we have ready awaiting vaccine. To be honest, I am hopeful that in the next few weeks, if the doses materialize as has been anticipated, I think hopefully a lot of these conversations will be a matter of the past, and we can really focus on the more important task of getting all of Peel and of offering a vaccine to all of Peel and certainly to across the province as a whole, working together. Thanks for the question.
Next question, please.
Thank you. My follow-up is for both of you again, and
Sure.
it's just on this. We know from your councillors, the meeting that you all had with the MPPs last week, some of the frustration around the vaccine. What you've just said now, and Dr. Lowe. So I'm assuming that both you and Dr. Lowe, in private, after that announcement last Friday, tried to find out why Mississauga and Brampton hadn't been included. So could you tell me what the explanation you were given was, or if you didn't ask, why you haven't asked in the back channels why Peel hasn't been included in this really vital pilot?
So the reality is these decisions were made without our consultation, Isaac, and I believe they're probably struck by the public health table at the province, along with General Hillier, who is making many of these decisions. And look, they are trying to prioritize the limited vaccine supply that exists. I would have preferred to have seen more of the vaccine in the hotspots, such as Peel region. However, for whatever reason, for logistical reasons, I am told, they're expanded out the pilot to other regions, some of which are in the green zone. So it may not have been the decision I would have made, but I'm quite sure that once there is more supply, we will all benefit and we will get as many vaccines in arms as we can. Dr. Lowe will also provide, he perhaps has more information than I do about this issue.
Actually, I mean, to the extent, Isaac, and thank you, Madam Mayor, to the extent that I have said that we are in constant conversation with our provincial partners, certainly recognizing the different needs and the different communities that they are balancing. I did reach out following when I was advised about the 3 areas and the communities that were in pilot, and I was just advised that that was the decision that was taken at the time. But certainly, there's a recognition that more doses are coming, and in the spirit of continuing to work collaboratively, recognizing that ultimately, vaccination across the province, and if obviously, I would prefer and would support additional supports and supplies here in Peel, especially as we're trying to get our mass vaccination clinics up. But overall, our goal is really to try to exit altogether as a province, and I think it's been a collective effort from the get-go, and I certainly recognize our health unit partners across the province and communities across the province have come together, and hopefully will continue to stay together as we try to move forward, and hopefully, again, with more supply, really making all of these sort of discussions and decisions hopefully a thing of the past. Thanks so much.
Next question, please.
Your next question comes from Ashley Newport at Mississauga. Go ahead, Ashley.
Hi, Mayor Crombie. How are you?
I'm well, Ashley. How about you?
I'm well as well. So I'm also going to ask about something that was discussed at council today, but something a bit different. You recently said that the city might be close to allowing private cannabis retailers to open stores in Mississauga, and I know that today staff told council that they're working on a report. But one thing was brought up at council, and that's that there's been a problem in Toronto, of course, with so many COVID-19 related closures. It seems that there's a lot of private cannabis retailers opening up, and in some places there's sometimes 4 or 5 stores open or opening on one city block. How concerned are you about this happening in Mississauga, and should the city decide to allow private cannabis retailers, is there anything the city can do to control the zoning so that we don't end up having big clusters in various neighborhoods?
So, Ashley, as you will know, that was our original concern. We wanted to be able to control the zoning, that those cannabis stores would not be in sensitive areas, and that meant more than just schools, it meant daycares, community centers, etc. And we didn't want to encourage clusters of stores opening in one region over another. We didn't want a concentration of them in, let's call it Port Credit or Streetsville, whereas if they were distributed throughout the city, we thought it made more sense. So we wanted to control over zoning. It has become apparent that we will not be granted that permission from the province. So ultimately the decision is, do we want to opt in as a result of what we have observed in other municipalities with their experience, and I think to date there hasn't been a lot of challenges. And I would say on the opposites, I will argue on the opposite side of what you have presented, is that in that we have seen a number of stores shuttered. It may be an opportunity to fill some of those storefronts. So this is a report that will be brought back to council. We thought before the summer recess, but it sounds like the city manager, Paul Mitcham, has promised it a little sooner. I know they're updating it with new information, bringing it up to date with all the relevant information on, how many licenses has been provided, what the experience has been in other municipalities, the fact that we won't be given control over zoning and concentration, etc., as no one has been, and we know that the province don't support giving us that power. So given the new information, would we be prepared to move forward? I think we always felt that we would move forward when it was safe to do so. But, we will be having that conversation. So, and as you know, I'm just one vote. And we'll see how that goes when it is presented at council.
Follow-up?
Thank you. And then on an unrelated note, housing numbers came out this month, and despite, a pandemic and despite, rolling lockdowns, the average house price in Mississauga is closing in on $1 million again, which is quite something when there's so many, condos that are typically more affordable. So I know Mississauga has had its own affordable housing plan for a few years now, and I know that the region's also responsible for affordable housing, but seeing this frenzy and seeing how difficult it is now for people to, own homes again, despite, a pandemic, are there any plans for the city to maybe start pressing higher levels of government to, really act on this, because it's kind of been a crisis that's been ebbing and flowing for a few years now, and Mississauga is always one of the places where housing seems to be, consistently very, very expensive and unaffordable.
Yeah, excellent question, Ashley. And as you know from recent planning meetings, this subject has come up, and we've talked about the making room for the middle and the priority we have placed on affordable middle-class housing, and how we do want to make it become a reality. We realize that housing is out of reach, and even recently, even more so. So more pressing and urgent need than ever. And what we're seeing is we're getting a lot of cooperation from many of the new developments that are being built, with the developers understanding and realizing they have to play a role and they have to do their part as well to ensure that a proportion of the new units in their developments are affordable for everyone, but particularly the middle class. So we are moving forward, and I encourage you to pick up some of the reports that have been discussed at the recent planning meetings.
Last but not least, your last question comes from Khaled Salama from My Second Home TV. Go ahead, Khaled. And I have to unmute him. There we go. Go ahead, Khaled.
Thank you, Daniel. How are you, Mayor?
I'm very well, Khaled. Welcome again. Always nice to hear your voice. Thank you for joining us.
I'm here. Thank you so much. Even with the limited supplies of the vaccine, can we still open the mass vaccination centers 24/7, and during the night even we can vaccinate the cruise operators of My Way?
So that's a very good question. As we know, we have limited supply. The mass vaccination sites are open right now by appointment for those 80 and over. And when we increase the supply, I know that the plan is that they be open from 8 a.m. to 8 p.m. And I know that I have heard Dr. Lowe say that if he could keep them open 24 hours because we have unlimited supply of vaccine, he would do so. So why don't I ask Dr. Lowe to comment on the hours of operation and the supply of vaccine in our mass vaccination sites. Thank you.
Thanks so much, Khaled, and thank you, Madam Mayor. Just a quick point of clarification, our 80-pluses are currently being vaccinated at our hospital sites, so William Osler and Trillium, as well as the University of Toronto, Mississauga, which is the one mass vac site associated with the hospital that are currently vaccinating 80-plus. We do have 7 community mass vaccination clinics that have been set up. At this point in time, they are not running 24/7 because we don't have vaccine. And as you know, the critical component of a vaccine clinic is to actually have the product to provide to people. Where supplies permit, we are contemplating a 24/7 pilot in some of those centers, perhaps later on in the spring, which is also when we're anticipated to get much more supply. But at this point in time, appointments remain limited and targeted at phase 1 priority groups, just with a recognition that supply still remains critically short, but is anticipated to improve in the coming weeks. Thanks for the question.
If you can just wait, because I have a follow-up for you, please.
Okay, Dr. Lowe? Certainly.
Thank you, Madam Mayor.
Go ahead, Khaled.
And Dr. Lowe, I know that you take your time to make decisions, but everybody's curious. Are you going to cave in for Madam Mayor's request and open the red?
Khaled, I think ultimately we are still continuing to follow the trends. As I said, they do appear to be plateauing and hopefully starting to trend towards the favorable again. I think we do know that we still have variants of concern in our midst. We do know that we are still seeing clusters associated with explosive growth. So to the extent that I keep saying we need to move gradually and cautiously, it'll all be driven by the numbers. So the numbers will ultimately determine what I end up saying and recommending on behalf of the residents of the region of Peel. So thank you very much for the question.
Is that the final question, Daniel?
That concludes our press conference for today. Thank you for everyone who joined. See you next week.
Thank you.